Hello dear all. Welcome back to my YouTube channel and lectures on series of history of medicine. So in this lecture we study Egyptian medicine first part. So it's an ancient medicine way back from 3300 to 525 BC. So the ancient Egyptian medicine marks the evidence of mummies found in the pyramids, the ancient medicine where physicians gave the medicines to the patients in the form of herbs. The papyri are the another important evidence found in the river Nile. So long before Hippocrates walked the dusty roads of Greece, Egyptian physicians were suturing wounds, diagnosing infertility, and pondering the mysteries of life after death. Ancient Egyptian medicine is sacred, ritualistic. Thus, we begin the study of ancient Egyptian medicine. Herodotus is called as father of Egyptian history. He is the first true historian known in the Western civilization. He lived during the classical age of Greece from 5th century BC. Egyptian medicine are always connected with the mummies found in pyramids and vital evidence of medical history. Scientists have identified various anatomical clues from the mummies. The Egyptian physicians were called as priests of Sekhmet. The ancient Egypt had specialists in medicine and surgery, equivalent to dental and veterinary practitioners too. Priests of Sekhmet are powerful and destructive as well, recognized as lion-headed goddess of war as well as supreme deity of healing. Concept of disease in ancient Egypt prevailed as malevolent, means having ill will, causing harm, influence, probably of stars, and had a magical aspect. They believed in treating not just the symptoms but the spiritual disturbance behind illness too. Thus, ancient Egypt had marked evidence of surgery, setting of bones, presence of pharmacopoeia, as well as remedies which were given as magical incantations and had very dubious ingredients but are rational basis, of course. Only after spiritual purification could a doctor proceed with rational healing practices. including herbal therapies and bone setting. Physicians used amulets for protection and gave magical spells. Thus, chanting spells and wearing protective amulets and invoking gods through incense and offerings was practiced often. Once the practitioner had dispersed or neutralized any malignant influence or evil spirits, he could then usually begin to treat the patient medically also if required. Thus, the concept of disease has remained supernatural. Art of medicine was a blend of magic and religion. Ancient Egyptians believed in immortality of soul and its reunion with the body. Mummification was universal from 4000 BC to 600 AD. Diseases prevailed were abscesses, polio, smallpox, leprosy, bubonic plague, clubfoot, and also some congenital anomalies were detected. Thus, mummification was not merely spiritual, it preserved so many anatomical clues. Mummies found in the pyramids. Thus, papyri and pyramids gave us wealth of information on the ancient Egyptian medicine. What are papyri? They provide knowledge about art, culture, medicine, and also the subjects of anatomy, physiology, medicine, gynecology, obstetrics, and dentistry too. These papyri gave us the information on art, different gods the Egyptians believed, and blessings by pharaohs, and also the picture of various instruments found in the mummies. Papyrus is known as a sage, a well-known Nile River plant. It's a material similar to thick paper that was used in ancient times as a writing surface. It was made from the pith. Pith is a soft central cylinder of parenchymatous tissue in the same plant. Of the papyrus plant, Cyperus papyrus, a wetland sage. Papyrus is a document written on sheets joined side by side and rolled up into a scroll, an early form of book. Thus, the importance of papyrus and pyramids in the ancient Egyptian medicine is remarkable. In 19th and 20th century, they were found at Thebes on the river Nile. Two important scrolls were discovered, Ebers papyrus and Edwin Smith papyrus. These are the photographs of Ebers papyrus, which gives us the information on various diseases. Edwin Smith papyrus gives lot of knowledge about ancient Egyptians had on surgery, as well the herbal medicines, mineral origin medicines, and animal derived medicines were practiced by ancient Egyptian physicians. Spiritual aspect of ancient Egypt. was diseases are caused by divine acts of gods. So these are various gods. King Akhenaten, treating diseases by sunlight. Sekhmet, lion-headed goddess for children, for war as well as healing. Thoth, considered as god of wisdom. Set god. Then spiritual concept of disease prevailed, and this Horus is a god of health. Ebers Papyrus describes diseases. So these pictures are available on internet as well as from the book. Delivery in squatting position and medico-magical religious treatment prevailed in the ancient Egyptian times. Ebers Papyrus is collection of myriad of different medical texts, had 110 pages. It includes the recitals before medical treatment, internal medical diseases, diseases of the eye, diseases of the skin, of the extremities, of the tongue, teeth, nose and ears. As well, it describes diseases of the women, explanation of various words or terms, and surgical diseases. Edwin Smith Papyrus describes surgical aspects and anatomical aspects. This is the document in the ancient Nile Valley. It deals with the ailments in the order of the bodily parts from head to foot. The discussion done in the systematic way as follows. First there is a title, then examination, third comes the diagnosis, fourth is treatment, and then glosses, a little dictionary of various terms. Third papyrus is Kahun Gynecological Papyrus. It is dated as 1825 BC. It describes the contraception, pregnancy diagnosis, toothache during pregnancy, sex determination, delivery in squatting position. Kahun Gynecological Papyrus is dated as 1825 BC, the 29th year of the reign of Amenemhat II. In 1825 BC, the text was published in Facsimile with hieroglyphic transcription and translation into English by Sir Griffith in 1898, now housed in University College London. So they serve a very important evidence of ancient Egyptian medicine. Papyri are very important like pyramids which give us the wealth of knowledge. Kahun Gynecological Papyrus is divided into 34 paragraphs and it gives us detailed information about various gynecological and obstetric aspects. First 17 have common format. Second section begins on third page, has 8 paragraphs which because of both the state of the extant copy and the language are almost unintelligible. Para 19 is concerned with the recognition of who will give birth. It may be related with the sex determination. Para 20 concerned with fumigation procedure which causes conception to occur. Para 20 to 22 is concerned with contraception and materials for contraception used were crocodile dung, 45 ml of honey and sour milk. Thus, further, it's detailed as para 26 to 32 concerned with testing for pregnancy by placing an onion bulb deep in the flesh. It is considered positive if odor appears to the patient's nose. Fourth and final section contains two paras which are not among any of these categories. First para describes treatment for toothache during pregnancy, and para second describes what appears to be fistula between bladder and vagina with incontinence of urine in an irksome place. So this was about the Egyptian medicine. So next video we study concept of medicine, causes of diseases, concept of disease in detail, mummification, diseases of women and children, surgery, contribution of Imhotep, father of medicine. Thus, Egyptian medicine was never isolated from its culture. It echoed their firm beliefs in balance, divinity, and continuity of life beyond death, which is reflected in the preservation of the dead bodies, what we call mummies, found in the pyramids. As we delve deeper in the next video, we will meet with all these concepts in detail. So this was about the first part of the ancient Egyptian medicine. Do like, comment and subscribe. As well, study Organon of medicine from my other videos in this channel. Thank you.